Hand, foot, mouth disease is a communicable, contagious disease with a benign cause caused by Coxsackie-virus A16, an enterovirus usually affecting young children. Coxsackie outbreaks have been mainly caused by EV71, which is a human enterovirus, and the human Coxsackie-virus A16, otherwise known as CA16. The focus of many studies have been on EV71, but not CA16, as the most critical and life-threatening cases were caused by EV71. In 1994, however, CA16 was the cause of the most significant HFMD case in England and was also the leading cause of the disease in Taiwan from 1999 to 2006. It is one of the most common contagious diseases, mainly affecting children under the age of 10, but sometimes adults can get it too. Its main symptoms are fever, vesicular rashes on the hands and feet and at the bottom, and also ulcers inside your mouth. The best possible outcome, if left untreated, for hand, foot, and mouth disease often resolve spontaneously in a time frame of 7 to 10 days. The common signs that occur are fever, vesicular rashes that appear on the patient's hands and feet, and oral ulcers. These manifestations will usually resolve without treatment. Hand, foot, and mouth disease is often self-limiting and is a disease that resolves itself without treatment. There are several severe complications that can occur, including meningitis, encephalitis, and acute flaccid paralysis. Meningitis is an inflammatory response in the membrane surrounding the brain and spinal cord. It is a potentially life-threatening condition that requires hospitalization for treatment. Encephalitis is an inflammation of the functional tissue of the brain, and children with the disease are generally hospitalized for multiple weeks as a result of treatment and recovery lengths. Acute flaccid paralysis is the abrupt onset of a weakness or paralysis in a body. The condition is potentially fatal if it affects the respiratory muscles in the body. Currently, there is no specific treatment or pharmacological intervention that can help to control and prevent hand, foot, and mouth disease. This is because these diseases are mainly caused by enterovirus 71 and Coxsackie-virus A16, where antibiotics will not work against viral infections. Children with these diseases usually have fever and painful blisters in the mouth, which will recover quickly within 7 to 10 days without any side effects. Therefore, the most expensive evidence-based approach in treating this disease will be over-the-counter medications such as acetaminophen and ibuprofen, which helps to control fever and relieve general discomfort. It is important to take note that aspirin should not be given to children, as there is a risk of contracting Ray's syndrome. Besides that, topical analgesics such as sprays and mouthwashes can help to ease painful oral ulcers. Good personal hygiene is very important in disrupting the transmissions of hand, foot, and mouth disease and is considered as the least expensive evidence-based approach in treating it. Since the disease is contagious, children with hand, foot, and mouth disease should be excluded from school and childcare centers for several weeks because the virus may remain in the feces. It is important to wash hands carefully with soap and water, especially after in contact with the blister-like lesions. A study reported that hand washing plays a significant role in preventing this disease. Besides that, children should be taught cough and sneeze etiquette in order to prevent the spread of the airborne droplets. Also, avoid sharing personal items like towels and toothbrushes, as well as avoiding using the same eating and drinking utensils. In our opinion, both approaches are fairly important since this disease is a mild disease and not life-threatening, which can recover in 7 to 10 days. There is no point in taking medications if you do not take a good care of personal hygiene, since both approaches complement each other. In addition, the least expensive approach is costless. It is just a matter of discipline in taking a good care of your personal hygiene. During the early detection or recognition of this disease, it is highly recommended for an individual to see their local doctor, GP, clinician, or in the case of a child, to see a pediatrician, whichever is most convenient or available to the individual. As these health professionals are typically an individual's primary source of help in the treatment and prevention of most health concerns. As these health professionals can examine the individual, make a diagnosis, and provide an appropriate treatment or referral to a specialist if needed. A clinician, for example, will perform an examination of the patient in order to identify the client's symptoms and signs of HFMD. From there, they can provide medical advice or treatment and prevention methods, or recommend them to go to the hospital if necessary. In the case of a child diagnosed with HFMD, it is highly beneficial for them to see a pediatrician as they have a stronger understanding of a child's health and therefore can better assist clinically monitoring them and ensuring a timely intervention in order to reduce the chance of acute morbidity.
Created using Powtoon.